Hey guys, it is Amanda and Barron with Kickin Cancer Cares on KSLM Radio, 104.3 FM and 1220 AM. Our sponsor of the second half is Venti's Restaurant. So if you were looking to eat healthier and be better about your diet, they are an amazing option to go out and feel guilt-free. They've got vegan, vegetarian, and gluten-free options, as well as just home good, feel-good food as well, like mac and cheese, burgers, tots, all of that good stuff. So they are an amazing all-around eat healthy or not eat restaurant. So go check out Venti's for dinner tonight.
We appreciate Venti sponsoring the second half.
Thank you so much, Dino. We appreciate you.
Well, I do want to give Dr. Pierce some time to talk about some advice you would have for patients, or maybe before they're patients, on how to...
Or people who aren't patients.
Who aren't patients, yes, that's right.
To never be patient.
Yeah. What's some good advice you have
Not
for
that disease.
Yeah.
So it's really very simple, but difficult to execute.
Okay.
So the first thing I would say is, if you want to be well, we're talking about, cancer is part of it, but really wellness overall, is have a purpose for being alive and a zest for living. And that really gets your head outside of your own head so that you're not focused here, you're focused out here. And people that stay, especially as they age, people that stay engaged in their families, in their community, and maybe their work, although work commonly changes as we get older, that's the number one thing you can do to be healthy, is to have a reason to get up out of bed every day and to participate in this thing we call life. So that's actually number one, way up high. Second, and a lot to do with cancer, but also overall health, is don't smoke cigarettes. Do not smoke cigarettes. You can extend that to tobacco in general, but I would especially say don't smoke cigarettes, because the combustion of tobacco and then all the additives that are put into tobacco products to make you addicted, and when they burn, it's terribly deadly. I mean, just terribly deadly. So if you want to rebel and be counterculture something, just pick something healthier. Don't do that to yourself. It'll aid you in so many ways, shorten your life, and commonly lead to a great deal of suffering for you. He's talked about diet, and if you look at the long-lived populations, it's really that farm to table. People do it differently. In the Mediterranean diet, farm to table is, again, mostly plant-based, not too much meat. It's actually like wine in their diets.
Right.
You got the Okinawans and Japanese. You have Seventh-day Adventists. A lot of the subpopulations that are long-lived really do that farm to table and really avoid processing food over and over and over again. So the closer you can get to that within the way you like to eat, that's going to give you the best diet, again, for overall wellness and health. The next part is age-appropriate exercise. So when you're young, you can do a lot of exercise. And when and it's easy and it feels good and you recover quickly. And then as aging occurs, it doesn't feel good necessarily when you do it. It's not easy, but it pays such huge dividends. I mean, it really does. And again, if you look at the long-lived populations, people generally within their culture have to move.
Right.
They have to do things. And if you live in a culture where the culture is set up to get out of your car and get out of your driveway in your car and drive to whatever you do, and then do a little walking around and get back in your car, you're disadvantaged. So you have to build that into your lifestyle. You just flat have to do it. And again, if you want to compete as you get older or do something, you can do more. But again, it's kind of that 2.5 hours of aerobics a week has been shown to be the sweet spot. And aerobics are just defined as when you're doing it, you're breathing a little hard and your heart rate is up. That's really all you need to do. You can do it in one sitting. Most people can't. You can do it, a little bit every day, but about 2.5 hours is a sweet spot where you get up and you move, you do great. And then finally, the whole drugs and alcohol. It turns out that, especially for breast cancer, alcohol at any levels will increase your risk of breast cancer. And it's kind of sad because people like alcohol, and there may be some other benefits, alcohol socialization and such. But if you drink, certainly true modest drinking is good. An ounce of alcohol for a woman, or 6 ounces of wine, or a drink, and maybe men 2 drinks. You shouldn't drink every day. And drugs are always bad for your health because it messes with your mind. So again, the simple way to think about it is have a reason to be alive. Don't smoke cigarettes. Get age-appropriate exercise. Farm-to-table diet. and stay down on the drugs. And if you do that, and that includes alcohol, if you do that, you're setting yourself up for great health. And again, you notice we didn't talk about a lot of specifics. Your wellness, what I just talked about, is 90% of your health. 90%. The other 10% can't be controlled by that. And then hopefully if you get sick, we can help you. So again, it's very simple to just focus on the basics and actually do them.
Well, I think a key thing you said is that it's not difficult, but it's hard.
Mm-hmm. Exactly.
It's because it's a lifestyle change you have to make, right?
Just build it into who you are.
But I feel like it gets easier when you start applying it more and more and understanding the benefits and the perks of it all. It becomes then a lifestyle more than a job, and this is what I need to do versus this is what I want to do.
Yeah, and number one is so important because generally if you want to stay engaged in society, especially as you go along with aging, you have to do 2, 3, 4, and 5 in order to be able to do that.
Yeah.
So that's a key motivator. So I'm a 69-year-old physician, and if I want to get up and take care of patients, I can't probably drink hardly any now at this part of my life because it messes with your brain. And if I don't take care of myself and eat properly, I won't have the energy or the ability to. So when you have a goal in mind, you're trying to participate and get out of your own head and give to others, you'll tend to do the other things. And that's probably why it's so powerful and important.
Makes total sense.
Yeah.
So how long have you been an oncologist, Dr. Pierce?
So I actually started medical school in 1977 and have been pretty much doing oncology since 1990.
Wow.
So it's a long time.
And I know that if I go to the hospital, Building C, which ironically is the cancer building,
Yeah, I like that.
organ oncology is within there, isn't it? So did you start organ oncology?
No, actually, oncology started in the late 70s when Dr. Bob Granatier was here from the University of Washington. And then he brought in Dr. Rasmussen as a partner, and there was some separation pretty quickly.
Okay.
Dr. Granatier was here, then my practice with Dr. Rasmussen and Orlowski, and then I joined in 1994. And so I joined at a time where things really kind of took off from the area growing, and we had more cancer diagnoses, and so that kind of led it, to take off to where now, organ oncology really pretty much goes from Woodburn to Corvallis and from Silverton to the coast.
Wow.
So we have a
pretty big
a
chunk.
large footprint and lots of patients.
So what do you see the future of oncology being right now?
Yeah, more accuracy, more precision, knowing how to better diagnose and actually better treat. So, AI is going to be a huge boon to accurate diagnoses because we still struggle with that. And the ability for a given patient to take all the information that's available out there from many computerized medical records and databases and actually bring that to bear on the patient in front of you with the practicing physician, and having that data and that input and that assistance will make diagnoses a lot more accurate. And then in the precision of treatment for the patient. So right now, the way we commonly do treatments are, we'll say, well, this group of patients got this treatment, and this group of patients got that treatment, and this one was a little higher than that one, so everybody gets this one. That actually doesn't tell you that everybody needs this, that's the best one for that patient. It just says as a group. Some of the patients would better start off with the treatment down here. And then also how much treatment, I think, is key. And how much means, so you'll commonly say, well, we need to give you 4 cycles of chemo or 6 or 8. Well, do you need 1 or do you need 12?
Right.
And again, the way we do is we copy the trials, and the trials are for a group of patients. So what does a patient need? And then finally, how good the treatments are. In the old days in '77, when I started in medicine, you were pretty much told that you had to suffer to get better because we didn't know how to not have patients suffer. We didn't know how to control nausea or any of the symptoms of chemotherapy. So I kind of said, well, that's the only way you get better. Suffering has nothing to do with effective treatment. It's an unwanted side effect. So as we get better, we do better with the toxicity or side effect of treatment. So in the surgical realm, which surgery is still an important part of cancer treatment, less invasive, less normal tissue removed. In the old days, big surgery, big cut, big wound, big opening, good. Now we've learned that the least you disrupt normal tissue, the better the patient does. So a lot more accuracy. Maybe you can do a colon cancer surgery instead of cutting. You can actually go in through the colon and do the surgery on the inside and then pull the tumor out. I mean, that's where they're going in some cases as an example to think of what people can do. Radiation therapy, again, you hear a lot about different beams and protons and et cetera. And again, that's all about, and using computer direction and simulation, you can really put the beam where you want to have the beam. So that's like very useful. And then in what I do, which is medical oncology, it was chemotherapy initially, and now we have very selective poisons that are pretty specific in killing your cancer cell, but the rest of your tissues don't have and it doesn't affect the normal tissue. And then the whole dream of harnessing your immune system, you'll see that a lot and read about it a lot. We do that a lot now, where you can actually activate immunity to go after the cancer, and there's actually no drug involved. So again, all those ways of treating cancer are in practice now, and they just get better and better.
Is immunotherapy becoming more of a benefit? I mean, is it used more often?
Oh yeah, so the number one drug in oncology last year, 29 billion in the United States, was Keytruda.
Okay.
So Keytruda, so I think it has like 29 indications. In some cases it's near curative. In other cases it's in addition to the benefit of with other drugs.
Oh, that's
awesome.
awesome.
So again, that's a lot better.
That's
I know
a huge comfort.
And there's a gentleman up in the Seattle area that threw our first pitch out for us last year, and he was diagnosed with stage 4 colon that became stage 4 liver and lung, and now it's stage 4 lymphatic, and they're using something called YP9. It must be an indicator they're trying to find.
Yeah.
Are you familiar with that one?
Yeah, I would say that's like probably the targeted therapy that brings a radiation molecule in.
Okay.
That's usually what that is. So again, different ways to target tumors, and we're doing that more and more. So you have a linker that can just attach to the cancer cell, bring in a radiation molecule, and that's again a whole area that's opening up in oncology.
That's exciting.
And, it's done in Salem, Kaiser, and it's also sometimes done at OHSU in our town.
Well, he says he likes it a whole lot better than what he was doing before because there's not nearly the amount of
Toxicity.
toxicity.
Yeah.
Suffering.
Yeah, you're not poisoning
Yeah, the
someone's
suffering
body.
thing.
Yes, the side effects.
Yeah, so lots of innovation.
That's so good.
Lots of innovation, and people really because we all know that for all our innovation and all our advancement, there are still people we know that are fine. They're sick for 3 months. They find out they have cancer and they're gone in a quick period of time, especially those internal cancer. And that's just such a huge fear for all of us.
Yeah.
And we're really working hard so that just goes away, and that we don't have to fear cancer the way that we do, because it is a fearsome disease. When it gets a hold of you in a way that we can't deal with it, it's just misery for everybody involved, and it still happens.
Do you see a day when cancer will not be that horrible death sentence that we've always feared?
Yeah, I hope there's not even oncologists. I hope there's not even a need for screening. Screening is about finding it early so that your treatments that you have, which aren't as effective as you would like, can actually cure it if it's just a little bit of cancer in your body.
Catch
and
it
it
stage
doesn't
1.
get away. Yeah, so you're trying to find early. But ideally, you don't need oncologists, you don't need screening.
Right.
And you just say, oh, wow, those poor old people in the old days when they were pretty ignorant and don't know much. And just go over it. They don't write because we don't write anymore. It's just like, here, I just sent the medicine to your pharmacy. Go pick it up and you'll be fine.
Yeah.
And you don't even need to come back. And so you don't go back. Generally, when you have an infection, you don't go back. And so the doctor can check you. So take your antibiotics and you'll be fine. And it really should come to that. And you look at the medical books from 100 years ago and they knew nothing.
That's
how we judge them. And look at the medical books and the research 100 years from now, we know nothing.
Right.
So that medicine marches forward, and there will definitely be the time. Then there'll be other challenges, but cancer won't be the challenge. It'll be done.
So you think immunotherapy might be the steady diet rather than the thing that we do to stop cancer? It might be the thing that we do to.
Well, immunotherapy is interesting, and the nice thing is once your immune system is activated, it keeps working the cancer. The problem with usual treatment of cancer is you hit it with something and the cancer notes it, but then what you can treat with, you can't keep treating with it. You just can't. And so, but the immune system just sitting there active, and if the cancer rears its ugly head, it just goes after it. So that's good.
And I've seen cases where someone had immunotherapy and that seemed to take care of the cancer but created some new side effects. Is that common?
Yeah, so what happens is that we don't yet know how to activate immunity that's specific against the cancer alone.
Okay.
So that obviously, and I had a patient that had terrible stage 4 lung cancer, And Keytruda was a drug of choice, and the patient got 1 dose of Keytruda, went into a complete remission, and it stayed in complete remission. However, the immune system attacked the pancreatic islet cells. So after that one treatment, they were diabetic forever.
Which is kind of what's
Oh, wow.
happening
And
to us.
there's no way to
Reverse that.
No, because the immune, just like type 1 diabetes, when your immune system eliminates your insulin-producing cells, it basically recreates type 1 diabetes. So it's just, and usually with immune side effects in the current era, we can break it with prednisone pretty quickly. So there's ways to mitigate it, but if it moves too fast, you just can't. I mean, it happens in a few hours.
But
So-
diabetes versus cancer, that's a
Okay,
win.
there you go.
I mean, that's a
Well,
win.
yeah, but still, it's
Still
not
a
good.
chronic.
Yeah.
Not good.
Well, I know that there's a gentleman in town that it was started as skin cancer on the bottom of his foot, progressed to his lungs, progressed to his brain. I don't know if they use that. They use immunotherapy for sure, which actually worked. It's get rid of the cancer in his brain and his lungs. But he's lost his hearing in the process, and the pancreas is not producing correctly, so he's got diabetes. And so it's not like a side effect of the treatment itself.
Like what he said.
But
Yeah.
again, the interesting thing, I had a patient at the coast who's over 100 years old who had a
Oh, wow.
large tumor, and she was pretty frail. And the prediction was the immunotherapy would have a pretty good chance of helping. And that treatment was every 3 weeks. After 5 treatments, it was gone. It was flat gone. It was flat
Wow.
gone.
Amazing.
And then we were kind of talking at the beginning of doing a year or two. And she said, I think I'll stop now. I go, I think that's a good idea. I'll see you in 3 months. I'll see you in 3 months. And if it starts growing, call me and we'll get you in. We'll
Oh,
look at
wow.
it.
That's
But
amazing.
again, you can see some things that, and with certain cancers, and again, having started this is really my 48th year in medicine for medical school, and some of the things we could do now are just dreams of the people back when I started. And again, we're primitive compared to how the future will look at us, and it'll get better.
Yeah, that's a good
It's an
news,
exciting
right?
time
Yeah.
to be alive, no question.
Yeah.
That's
That's good.
wonderful.
So again, cancer is to be avoided. Be healthy. Take care of yourself. And if you happen to get cancer, hopefully it's a form that we can take care of for you.
And then where would they find you, Dr. Pierce? Where's your office at?
Oh, just Organ Oncology Specialist. Actually, right now it's in the C building.
Yeah.
We're in the C building. Actually, now we're called Organ Specialty Group because we
Okay.
have rheumatology, infectious disease,
Oh, yeah.
and hemonc. But anyway, Bud Pierce, you can find me. And I'm actually at the coast, currently in Newport, but I'm bringing that back home. And then I'm at North Lincoln on Fridays.
Okay.
Okay. Because what you deal with cancer all the time, is that difficult? What are the challenges you face seeing people that may not survive or that turn around and survive and beat the unbeatable?
It's rewarding and challenging because again, actually most patients do very well. If you look at all the patients, if you look at the denominator, the total number of patients you see, most patients do really well. And we also do blood diseases. If you look at, there's some tragic cases where you lose people and you really can't figure out why the treatment helps some and doesn't help others. There's a randomness almost to it. At least random to us, there's a reason, but we just don't understand it. So I think that if you go to work as a practicing physician and every day you're trying to help people, and you can help people, you really can, and if you're satisfied with that, then it doesn't get you down. So if it's a little old lady that needs to be placed in a care center, not so much because of the cancer, but she's just kind of failing in every way, and society inadvertently is setting up roadblocks to getting her the care she needs, and then the family situation isn't right, and you kind of mobilize everyone, and they get this lady in a good assisted living. That's rewarding.
That's a win.
But you did that rather than just saying, "Well, I'm the oncologist, so this is what I do, and I can't help with the rest."
Yeah, you stay away from
so
it.
really, can you help people?
Yeah.
Can you help? And if you when you're practicing in medicine, if your goal is to help people, you can always help people. If that's
Totally
your
agree.
motivation, you'll have your satisfaction. If your goal is cure, you better not be like a neurosurgeon that does brain tumors, because that's a really challenging one for us. Or a person specializing in pancreas cancer, that's another one we really challenge with. But again, you can always help.
Yeah.
And if you say I'm going to help, and again, if you practice enough, you'll see some amazing saves. You know, most of the time when I look at those, I call it God, you know, God stepping in because not me.
Yeah.
So you can see that, and again, that's got to be your satisfaction for a long career,
Okay.
helping people.
I love that. That was a great answer.
Yeah, just what you expected, right?
I was expected that it would be, it's hard, because I can only imagine that it would be difficult. But the way you just explained it, that's looking at the positive side of it and yeah.
Helping.
Yeah, helping.
Exactly. Well, we appreciate you guys being here. Appreciate you showing off the stadium and doing some more cancer awareness nights to help some more survivors get a chance to be inspired as well along the way.
Absolutely.
Any other great advice, Dr. Pierce, before we cut off here?
We've got about
I
5
would,
minutes.
I would just say I would encourage everyone to just engage in life. If you come from I know this group, a faith perspective, it strengthens you greatly. And, you know, being out of your own head and serving others will give you that great life and give you, no matter how long you live, will give you a meaningful life. I would say get your mind off yourself.
Yeah.
Just get your mind off yourself. And it's so easy, especially as we age, it's not like it goes this way. You got to go that way.
That's why those aches and pains are inflicted on us.
Yes.
I'm not going to think about that today.
Okay, can I ask you what your favorite healthy meal is?
Oh, I eat a variety of foods. I mean, I don't have, you know, it's interesting. In 2015, before COVID, I pretty much lost my taste and smell, and I have no idea why. They're gone. So it's really hard. Right now, I can taste sweet, and I can taste spicy.
Okay.
So I like that. So I guess I would say I like a wide variety of ethnic foods. You know, I like Chinese food. That's good. I like Mexican food. Because again, the spiciness, once your taste and smell kind of really goes, I really like the consistencies.
Okay.
And I take some solace. I take some solace in the Ben and Jerry's story because one of them lost his taste and smell in his 20s.
Oh, really?
And so he was the consistency guy.
Oh, there you go.
And the other one was a flavor guy. So
that's
I just
awesome.
I just eat a variety of foods, and I just try to avoid processed. I try to avoid.
Yeah.
But I have to say, processed is good too.
Processed.
Like
I'm teaching my
100%.
kids that right now. Right now.
Yeah.
Process is hard to avoid, but
Yep.
we can if we try.
Well, it's unfortunate. It's because we are convenience people.
Yes.
And
You don't realize it until, like with kids, like I was saying. So I used to get like little mini frozen corn dogs, frozen puppies. Now my freezer's empty.
Yes.
We have like trays and maybe leftover frozen meat, things like that. But we don't do frozen food anymore.
well, that's why Costco got rid of their coffee thing so they could add more frozen food to their
Crazy.
offerings. And I totally understand that. I mean, I like to make healthy pasta. I use cream sauce, heavy cream, very important.
Actually, the fat of good fat. So
It's
like
good
olive
fats,
oil and
butter,
even milk fat.
yeah.
It helps satiate your hunger.
Yeah, exactly.
And if you try to go, because we've never had more diet foods in the history of America, and yet we're not
skinny.
So it's almost like it's telling you don't go that way.
That's
Right.
right.
Don't
And we're like the
go
only
that way.
country that does.
Yeah,
because
don't
everyone's
go
like
that
Because all the other people are smarter than us.
Yeah, don't go that way. And stay away from the sugary garbage. drinks.
Yeah. It's interesting. I learned a lot of things about sugars.
Yeah.
And allulose versus I don't use sugar. I don't use a lot of stuff. But yes, heavy creams, butter. I use just a little bit because, as you say,
Satiation.
it's very satisfying. And pastas, I like to make cream sauces. I'm not a tomato sauce person. Never have been.
Same.
Yeah, and so it's always that cream sauce. I want the creamy garlic sauce on my pizza.
And if you watch people that learn how to do that, they can do it quickly.
Yeah.
You know, just when you don't, and
Yeah.
you're like afraid to go and try it. When you watch people that know how to take basic ingredients and put together a meal, that's
It's talent.
again, it's not, you don't have the processing steps. And
Yeah,
that's
you
really,
don't.
really what you have to do.
Chopped is an amazing.
Oh yeah, that I have heard that.
And simple foods is so good. It's amazing how good you can make it all taste. I'm very happy with just simple ingredients.
And it has a lot to do with what Bud said too. Food should just be a part of the decisions for health. It should not be an all-consuming thing.
Yeah.
Because what's most important is what did I do for someone today? You know, for me, it's did I keep my mouth shut when I really wanted to say that? And, you know, and I mean, just supporting people and making them building other people up, having that opportunity. When you make a meal, you share a meal, but you know, and you walk away from it saying, okay, that was pretty good. I'll do that one again.
Yeah.
And being satisfied easily, that's a big deal.
And soups and salads are easy to make. And
I love salads.
Well, we really appreciate you guys being
Yeah.
on the show.
Thank you.
Your
Thank
advice,
you.
your history here.
Absolutely.
We did have a fun timeline, we always do. It was September of 2022, and we had decided to do a disc golf tournament down in Albany, and we created this banner and put it along Spring Hill Road. So as people were coming up and down the road, they got to see this big banner of what we were doing at that disc tournament, and that was a really, really fun event.
That's awesome.
Yeah,
All right.
And that's very important.
yeah.
Yes. So huge shout out to Venti's Restaurant, who is our sponsor for the second half. So if you guys are looking for vegan, vegetarian, or gluten-free options, they are your go-to for amazing, phenomenal, delicious food. So thank you, Venti's. And we will be back next week
As the movement continues.